In this video by deck plate, we will understand the VA rating for diseases of the peripheral nerves. Upper radicular group, 5th and 6th cervicals, middle radicular group and lower radicular group. Disclaimer. This video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Today we will delve into the VA ratings for diseases of the peripheral nerves. We will cover the ratings for both lower and upper extremities, providing detailed information on how different levels of paralysis are evaluated. Upper extremity nerves. Upper radicular group, 5th and 6th cervicals. Diagnostic code 8510. The upper radicular group controls movements in the shoulder and elbow, with the hand and wrist generally not affected in complete paralysis. Complete paralysis of the upper radicular group. All shoulder and elbow movements lost or severely affected. Hand and wrist movements not affected. Major rating, 70%. Minor rating, 60%. Incomplete paralysis. Severe. Major rating, 50%. Minor rating, 40%. Moderate. Major rating, 40%. Minor rating, 30%. Mild. Major rating, 20%. Minor rating, 20%. Middle radicular group, diagnostic code 8511. The middle radicular group affects the movements of the arm, including adduction, abduction, and rotation, as well as the flexion of the elbow and extension of the wrist. Complete paralysis of the middle radicular group, adduction, abduction, and rotation of the arm, flexion of the elbow, and extension of the wrist lost or severely affected. Major rating, 70%. Minor rating, 60%. Incomplete paralysis. Severe. Major rating, 50%. Minor rating, 40%. Moderate. Major rating, 40%. Minor rating, 30%. Mild. Major rating, 20%. Minor rating, 20%. Lower radicular group, diagnostic code 8512. The lower radicular group controls the intrinsic muscles of the hand and some or all of the flexors of the wrist and fingers. Complete paralysis of the lower radicular group. All intrinsic muscles of the hand, and some or all of the flexors of the wrist and fingers, are paralyzed. Substantial loss of use of the hand. Major rating, 70%. Minor rating, 60%. Incomplete paralysis. Severe. Major rating, 50%. Minor rating, 40%. Moderate. Major rating, 40%. Minor rating, 30%. Mild. Major rating, 20%. Minor rating, 20%. Understanding the VA ratings for these peripheral nerve conditions is essential for veterans dealing with nerve damage. Accurate ratings help ensure that veterans receive the appropriate level of disability compensation. If you or someone you know is experiencing symptoms related to these nerve conditions, it's important to seek a thorough medical evaluation and consult with a VA representative to understand your rights and benefits. Thank you for watching this video. Please don't forget to subscribe and like our videos.